we're expecting the closure of around 2,200 health facilities next week. And that'll be a precipitous end to healthcare across the country and catastrophic for public health. And in my experience, it's a completely unprecedented eventuality in any humanitarian crisis that I've been associated with. So it's a critical situation. Over the last 20 years, there have been some tremendous health gains across Afghanistan. Deaths amongst pregnant women have reduced by around 60%. Deaths amongst children have reduced around 50%. Perhaps one of the biggest successes of the last 2 decades has been this health project called the Basic Package of Health Services, which has supported the delivery of healthcare across over 2,200 health facilities in the country, including all 34 provinces. That's been the backbone of the health system. I mean, that project is under huge threat. In fact, the main international donors for that project are, because of their own rules and regulations, can no longer channel funding through the government. And so the organisations that are funded by the government to run the health services in those clinics and hospitals will no longer be able to support healthcare. So COVID remains a big problem. The Delta variant, the Alpha variant have been identified in the country. There's been around 153,000 cases to date, and the biggest spike in the number of cases was in June, July. So we've just come off that spike because of the Delta variant, because people have been displaced from their homes and accumulating, gathering in large, overcrowded settings. So we could well see an acceleration of the pandemic in Afghanistan in the coming days to weeks. The borders have been closed. We haven't been able to bring in medical supplies. And this has been one of our big priorities. We had previously had 3 cargo planes full of medicines expected to come even before the problems of the last few weeks. But all commercial airlines were stopped from landing, including charter aircraft. So it's been a desperate situation trying to get the supplies in. So the Taliban in Kabul has appointed a health commissioner. He is working closely with the former Minister of Health. He's encouraged the Ministry of Health staff to stay on board. And he's also met with health partners, including WHO, UNICEF and others. At provincial level, across the 34 provinces, they've also appointed health officials at that level. We're dealing with them there as well. And again, COVID is one of the priorities, but women's health is another, child health is another. So there's a lot of things on the health care plate right now, and we're trying to be as constructive with the Taliban officials as we can. The Taliban have said some good things. Their health appears to be one of their priorities. The fact that they've invited the previous health minister to stay on and most of the ministry staff to stay on is encouraging. And we've conveyed to them what we consider the key health priorities. And of course, women's and children's health is absolutely amongst our top priorities. I think the Taliban officials realize that they need the international community who've been providing the backbone in terms of resources and funding to the healthcare system. So we hope the engagement remains, it improves and becomes more positive. We're very worried indeed. We think that the cessation of healthcare across those 2,200 health facilities, I mean, that's a precipitous end to the delivery of health services across an entire country. It's going to be one of the biggest public health crises that we've seen in decades. We are working with our partners and in fact with the donors to try and work out the best immediate and short-term and medium-term response. So we're working with some of the NGO partners to identify around 150 priority health facilities that we will really target and support with medicines and funding and staffing. Then we've identified a second round of 300 second priority health facilities. But at the same time, we're working with the donors to identify other channels to direct the funds so we can get those other 2,200 health facilities back online as soon as possible.